Need It Most Home Care Employee Orientation. Welcome to Section 3 of your orientation training. In this section, we'll review the policies and procedures for emergencies and disasters. Please make sure you have downloaded the orientation handout from Gusto. We will reference it throughout this presentation. You may pause this presentation at any time. If an emergency occurs, such as any of the following, please call the practice manager. Emergencies include patient condition drastically changes, environment becomes unsafe, or the client requests a service outside of job description. If an emergency occurs and the client becomes unconscious or is injured, call 911. Then immediately call the practice manager until reached. Overall, if there are any questions, concerns, uncertainties, or incidents that affect the delivery of service in accordance with the client service plan, please do not hesitate to contact the main office. Need It Most Home Care maintains written emergency information on each client. The information collected includes 1. Name and telephone number of the client's attending physician, 2. Client's hospital preference, 3. Names and phone numbers of client's representatives and other emergency contacts, 4. Known medication, pertinent medical information, including allergies. The clinical record includes the client's written authorization for staff to seek emergency treatment, including transportation for treatment. Please refer to the client's file for emergency contact details and medical history. An incident or disaster is an occurrence caused either by humans or by a natural phenomenon, which requires or may require action by home care and emergency service personnel to prevent or minimize loss of life or damage to property and/or the environment. The manager, who serves as the incident commander, has the authority to activate and deactivate this emergency preparedness plan based on information known to him or her at the time of which indicates such need. Examples of incidents include fire, both structural and wildfire, weather-related emergencies including snow, ice storms, heat, and flooding, hazardous materials accidents, power outages, natural disasters, terrorist events, and incidents of naturally occurring disease outbreak. An emergency supply storage area will be maintained at the office for employees during the time period that they are working in the event of an emergency and will be updated and maintained. If an employee is unable to visit the client due to a disaster or incident, both the client and emergency contact person should be contacted. Assigned triage levels are documented in the comment section of the Comprehensive Care Plan. Need It Most Home Care employees are required to participate in drills so that they are able to promptly and correctly carry out their assigned roles in case of a disaster. Please refer to the orientation handout for more information regarding disaster planning, fire, and emergency procedures. Need It Most Home Care will use the following to assign triage levels. Triage Level 1. Require only minimal amount of care, require less complex treatments and/or observation and/or instruction, provide self-care or have a willing and able-bodied caregiver, do not exhibit any unusual behavioral problems. Triage Level 2, require an average amount of care, no longer experiencing acute symptoms, require periodic treatments and/or observation and/or instruction, require some assistance with ADLs, require help for limited periods, or have willing and capable caregivers, exhibit some psychological or social problems. Triage Level 3, require regular or frequent care, above average, require daily treatment and/or observation and/or instruction, have willing caregivers whose capabilities are limited, require assistance with ADLs, ambulate with the assistance of 2 people, exhibit disorientation or confusion. Triage Level 4, require a maximum amount of care and have no caregivers in the home, exhibit acute symptoms, are confined to bed, require complete care, require treatment and/or procedures necessary to sustain life. Please refer to the CCSP handbook for further information regarding triage levels and disaster planning. If you have any questions, please notify your manager. Practice fire drills are conducted monthly at our office and at each client's home. Review the following: fire drill log, fire drill escape, fire safety checklist. The fire drill form is completed after each drill and includes the date, time, number of staff or participants, any problems, and action steps taken to resolve problems. The fire drill form is kept at our office in the Disaster Preparedness folder and is available on Gusto. Client home fire drills are documented in the same way and are kept in the client's folder. Emergency instructions and evacuation routes for the client's home are kept in the client's home folder. All clients will be encouraged to keep an emergency go kit available, containing easy-to-access information on emergency contacts, prescription medication needs, and supplies. At the very least, all clients and staff must be aware of the must-dos and be prepared, such as having a several-day supply of medications and a medication list in case of a disaster or emergency. Let's review. The practice manager should be contacted for emergencies in addition to 911. Need and Most Home Care maintains written emergency information on each client. We define disasters, also known as incidents, and discussed appropriate policies and procedures for each. We discussed the different triage levels that will be utilized in case of a disaster. Employees are expected to complete monthly drills and practice fire safety. Congrats, you've now successfully completed Section 3 of your orientation training. You may now move on to Section 4. If you have any questions regarding this training, please contact your manager.